During those moments in the waiting rooms, when the outcomes were unknown, I made a promise to help those doctors in any way that I could. Scott was born in June of 1971. He was born in the morning, and all seemed well. The next day I went off to work and received a phone call from my wife, although she couldn't speak. So I knew something was wrong. Scott wasn't being brought to her to be nursed because he had now been moved to intensive care because he had a significant heart murmur. I met Welton Gersony, who after one day said, "Let's operate." To us, we thought we were bringing him there just to have him there.
Well, Scott had what we call aortic stenosis, and it was severe. And if we hadn't done anything about it, Scott wouldn't have lived more than a few more days.
When I was first diagnosed, I was only 5 weeks old. I have zero recollection of that. My earliest is really when I had my second surgery when I was 9 years old.
To be quite honest, I had no idea of his surgery or his prior surgeries. We, played ball, ran around together.
I can remember waking up in the intensive care unit, tubes and everything. Turn my head and I look out the window and I see Dr. Gersony. I remember seeing him and feeling very comfortable and thinking everything was going to be okay. Dr. Mom did both surgeries. We knew his reputation was, to be the best in the world at the time that I had both surgeries.
Well, there were many changes during the course of my career, almost daily, in the techniques, what we could correct, and they're still changing today. Probably the single most important long-term change was moving corrective surgery to the younger age group, even to infants.
Scott Roskin was actually born with a faulty aortic valve stenosis, and in the early 70s, the only option for a child born with a valve like his was surgical repair or replacement of that valve. Nowadays, actually, we have transcatheter valves that we can actually put in to replace a congenital abnormal cardiac valve. It's been crazy how fast-growing technology has been in the development of these techniques that are less invasive and as long-lasting as the surgical counterparts.
I realized that a program to be successful needs the support of the patients, in our case, parents of patients. Mr. Roskin was a leader in this area. He never wanted to be recognized. He always stayed in the background, modest. You were great. And he and others built the Baby's Heart Fund to what it is today.
I think my father is thrilled to be honored. He's, spent an enormous amount of energy and time working for the Baby's Heart Fund. He's not one to look for attention, but in this case, I think it's rightly deserved.
With his foresight, he created a community through the Baby's Heart Fund, which brings physicians and families together to collaborate, to be innovative and advance the technologies and the training in pediatric cardiology.
Well, Connie and I were sitting home one Sunday evening and we got a phone call from Bob and Scott Roskin saying they would like to sponsor a chair in my name.
James' mom was a great pioneer, always pleasant. He's really one of the great surgeons in the history of our American Society of Surgeons who take care of patients with heart disease and children.
What Welton asked for was support so that we could train the fellows and give them financial support, and that those fellows would go out all over the country and in fact all over the world. So we're not only training New York cardiologists, we're setting up a network of pediatric cardiologists that are all over the world and that can consult with one another. Our dedication is unwavering. It's because of the success. 2 operations, and Scott's now will be 42 this year.
Hard to believe.
Who would have thought?
Great guy, great kid.
I was very fortunate that my father passed along the chairman position to myself and John Mineo, of course. We've got, You know, thousands of grateful parents, including Evan.
My first child was diagnosed in utero and also had heart surgery when she was 4 days old. I had always known about the Baby's Heart Fund and supported where I could when I was younger. You know, we've been friends for so long, and now we're doing this together. It's pretty amazing.
We've had tremendous success and look forward to passing it on to the next generation.
I went in being very nervous. I was very scared. I didn't know what was going to happen, and I actually say in the book that I thought I was going to die.
When I found out, I was scared for him, and in the book it shows question marks all over the page.
We thought, what a better way to tell about our story of friends being such a great thing and how everybody needs a friend. Well, half of the proceeds from our book are going to the Baby's Heart Fund here at Columbia University Medical Center.
I think that it's an extremely noble cause. I mean, to fix these children. I remember that was the word that I kept using just with our daughter. I mean, we had a broken piece and it was fixed. And she's 12 years old and she runs around and she's wonderful and everything's fantastic.
What we want most is to be the advocate of the child and to offer them the best life that they can have with a healed heart.